Thank you and good afternoon again, everybody. And thanks for your time as we talk about this important public health issue. As noted, we have received several questions in advance of this briefing, and we will address those shortly. If reporters have other questions, please email those to the Task Force Public Information contacts, and we will do our best to address them during this live stream or later today. So as a reminder about the counties where we do our modeling, and so I know there's been a lot of questions about what are the boundaries of the modeling. So these are the boundaries for the population that we do. It's a little bit different than the members of the pandemic task force, which are the members of the three big systems, BJC Health, SSM Health, Mercy, and then St. Luke's Healthcare as well. And so I wanted to make sure we were clear on what data we're talking about, as well as the limits of the modeling. So when I give data about the healthcare statistics, those are coming from those four healthcare systems: BJC Healthcare, SSM Health, Mercy, and St. Luke's. So let me move on now to slide number 3, and I'll update the numbers that I shared yesterday. And again, these data are combined of our four healthcare systems. So what you'll see on the slide here is hospitalizations are essentially flat from 586 yesterday to 585 today. The number of patients in the intensive care unit are very similar. It was 239 patients yesterday, and today it is 233. And the number of patients now on ventilators is the same as yesterday, 186. We are still seeing the same proportions of numbers that we would expect in our patient population, with about 70% of patients in the ICU are ultimately going to be on the ventilators. The numbers from yesterday to today haven't changed much, and we know there's going to be days like that. But make no mistake, we're still on the steep part of the curve. And as I've mentioned a couple of times in these briefings, don't focus as much on the change from day to day. We'll be looking at the trend over time so that then we can make some inferences about where we are in this pandemic. Also, there's some interest in the current numbers as regards to a percentage of our capacity, and we're working on those numbers right now. Those numbers will flex day in and day out, and so we want to make sure we're being as accurate as we can. And also those numbers will change as we see more patients come in and as our healthcare systems build out more capacity to take care of those surge in patients. So we're working on those numbers, and we believe we'll have an accurate picture for everybody within the next couple of days. I can tell you right now in terms of capacity, we're doing okay. It's still early on, though, in the curve. And so even though we feel like we have adequate capacity right now to take care of those patients, we're also leery of what's going to be coming ahead, and we want to be prepared to take care of that surge to come. One other piece of data that we're going to start providing to you on a regular basis, after spending time in the hospitals, many patients with COVID-19 are also getting better. And so we're going to start collecting data on our discharges as well. And so across the system today, I can report that we had over 40 COVID-19 patients discharged yesterday alone. And I think that's a great sight for all of us in healthcare to see patients improve, leave the intensive care unit, and go home. I will say one other thing about data, and sometimes this gets lost in the conversation, is these aren't just numbers. These are patients. These are friends. These are families. These are loved ones. And so even though we fixate on the numbers, we must be continually reminded that these are people that we're talking about and not just numbers. As I mentioned yesterday, what the region has done over the past weeks has helped, but we're continuing to see new patients with COVID-19. The virus is incredibly contagious and spreads extremely quickly, and these numbers can change quickly as well. And so we really have to stay on top of this and keep doing the things that we're doing to prevent the spread. This will save lives, and it will help the healthcare systems remain equipped to handle whatever surge is going to be coming our way. As a task force, we continue to very carefully monitor this situation and the resources that we need to respond to this. And I'll leave us again with the curve. So you've heard me talk about this before, the hammer and the dance. We want to be on the purple curve and not on the other two. So we need to continue doing the things that we're doing right now, our social distancing, making sure we're washing hands, cleaning surfaces, staying that 6 feet apart. All of those things contribute to the decrease in spread. We decrease spread, we decrease infections. We decrease infections, we decrease the number of patients. If we do that, then the healthcare system can operate more effectively and efficiently and ultimately save more lives. So that concludes my remarks. We're going to go to questions now.
Dr. Garza, many non-essential surgeries and procedures have been postponed during the pandemic. Are nurses who normally work in these areas reassigned to help with coronavirus patients? I'm asking because a surgical nurse we spoke with expressed frustration that she was not being utilized when she wants to help.
Short answer is yes, and so it's a little bit more complicated than that, though. So we essentially have to train nurses that are used to working in operating rooms on how to take care of COVID patients and how to operate on those floors, because we want them to be safe and we want them to be effective. And so we are pulling those pools of resources together, retraining them, and then we'll be redeploying them as the volume increases from our expected surge. So short answer is yes, but it's a long process.
Do you envision a time when personal protective equipment, PPE, will be distributed throughout the population?
Maybe in the very far future. And so the reason I say that is you've heard me talk numerous times about the challenges with getting personal protective equipment for the healthcare systems and the strains that we're under. And so I haven't seen anything that leads me to believe that the supply chain is suddenly going to open up to be able to provide for members of the general public. And so right now, the best advice that we can give for the general public are keeping your hands clean, practicing social distancing, keeping surfaces clean, all of those other things that we've been talking about, for the past couple of weeks.
Several questions along this line, Dr. Garza. Our viewers have contacted us about people who have recovered from COVID-19, as well as the number of those diagnosed or who have died. How hard is it to track the number of people who have recovered? Is there more to it than subtracting the deaths from the total number of diagnoses?
Yes, it is more complicated than that. And so when you're looking at the model, it's called an SIR model, which is susceptible, infected, and then removed. So essentially this question is asking about the population that's been removed. And those are people that are now immune or have passed away. So as I've mentioned a couple of times before, when we talk about how many people do we think have been infected out in the population, that's really just an estimate. And the reason is because we don't have those large quantities of testing to get a really good idea on the number of people that have been infected. So the best thing that we can do is go by some of these modeling numbers. We'll never know with absolute precision about who is immune in the population. Now, we are working through some discussions and doing some lab work on doing testing to see if we can identify those people that are immune in the population. Those are called serology tests. And basically what they do is they measure for antibodies for the coronavirus, for this particular coronavirus in the blood. And so there's ongoing work to see if we can do sampling for that, and that might give us a better approximation on immunity in the population.
CDC, Centers for Disease Control and Prevention, has issued guidance recommending that people wear cloth masks when they go to grocery stores or other essential locations, but where social distancing can be hard. Do you concur with those recommendations, or what guidance would you offer to the public?
Right. So a lot of questions come up about cloth masks. And so one of the things that that when the CDC guidance comes out, it says in those places where social distancing is a challenge and you can't practice those other personal protective, measures. And so if you think about where places are where there is a higher concentration of people that come together, and of course that increases the probability that there's going to be spread of virus. So that's why we close schools, and that's why we don't allow large gatherings, because we don't want a cluster of people, because that increases the possibility that the virus will spread. So of the things out in the community then, if you can think about where are the places where people go, where they have to go? Well, people have to go to the grocery store. You know, people have to get food. And so those are areas where there is a potential for a higher possibility of virus being spread. And so if you think about it that way, it is very prudent then for people that are visiting those locations to take extra precautions. And that includes wearing the cloth masks, making sure you're keeping that 6 feet apart, making sure you're washing your hands, keeping surfaces clean, all of those different things. And so what my advice would be is in those areas where you can have a cluster of a lot of people that come and go, to practice all of those techniques so that we can decrease spread. And that would include the cloth masks.
Dr. Garza, is there information locally that supports the trend emerging in other parts of the country that shows that minorities are comprising a higher portion of COVID deaths than other groups? If so, what are some of the reasons for this trend?
Mm-hmm. There's so great question. There is anecdotal evidence coming out of the St. Louis region right now that shows that there is a higher proportion of people that are affected with COVID-19 in the minority population. And so we're starting to look at those numbers right now, and we're starting to collect those numbers, and we'll have a little bit better idea going forward about that. And this is tracking along with what we're seeing in other cities, such as Detroit and New York and Chicago. And the reason for that isn't necessarily about race, it's about social inequities. We know that populations that are socioeconomically challenged, that don't have access to good health care, that don't have access to nutritious food, are victims of many diseases, including diabetes, high blood pressure, all of these things. So the question isn't really, is it affecting a minority more so than others? Really what it is it's an indication of social inequities that existed before this pandemic came around. And so really it's a symptom of the disease of social inequity. It's not that the virus has any predilection for minorities. It really is just a reflection of what we know already exists out in the community.
Dr. Garza, what is the survival rate for patients who have been put on ventilators? Do you have numbers of the total, regarding the total number of patients put on ventilators and the number of patients who have gotten off the ventilator? So
we don't have that precise data for the St. Louis region right now. Our data teams are looking at all of those various data points, and so we believe that we can get that data fairly soon. We know, though, that if patients are admitted to the intensive care unit, looking at some results coming out from other places, such as New York and things like that, there's a high percentage of them that do pass away, unfortunately. But we don't know the exact percentages for the St. Louis region right now.
Dr. Garza, we have a couple questions regarding the current modeling. Mm-hmm. I'll read two of them that again are related. What is the current predictive modeling for number of cases and deaths? Another reporter put that slightly differently in asking, is there any evidence on progress on efforts to flatten the curve?
Right, so let me take those one at a time. So I don't have any modeling prediction on number of deaths here at my fingertips. So let me pass on that one. So and I've shared numbers about the number of cases within the statistical area at 80,000 by the end of April. And again, remember, this is approximations based on modeling, based on whatever inputs we put into there, such as number of cases that we're currently seeing, all of those different things. And so if you think about what you see nationally and internationally about a case fatality rate, so part of the challenge is we don't know what a denominator is. We kind of know that it's around 80,000, and we think around 1 to 2% of people that are infected with the virus will be a fatal case. But it's really tough for us to understand that denominator because we don't have that massive testing going on right now. I'm sorry, what was the second question?
Any evidence of progress on efforts to flatten
Right.
the curve?
It's really too early to tell right now. So if you remember, we started doing these press conferences 3 days ago, and so that was really the date that the healthcare system started collating their data for the statistical area. And as I said, we don't want to look at day-to-day trends. We want to look at long-term trends. So I think in the next week or so, we'll be able to say whether we're having an impact on that curve or not.
Dr. Garza, with testing continuing to be so limited, how will we know when we're able to end social distancing? What does the end of social distancing look like?
Yeah, that's a great question. It's a question that gets asked quite a bit. So short answer is I don't know. The longer answer is we have to be really careful when we're talking about relaxing social distancing rules. There is plenty of history out there, including our own history in St. Louis during the 1918 influenza pandemic, that showed even though we had blunted the initial curve and were well known for that, then when we started relaxing social distancing rules, we had a second wave that was actually worse than our initial wave. And so the infection data is always a lagging indicator, so it takes a little bit of time for us to understand what's going on out in the community. We are taking a look at some of the data, and we'll be looking at it going forward to say when do we believe we could realistically start relaxing some social distancing rules. But we also have to be careful and say, what do we want to look for in case we need to, again, tighten those restrictions? So that's the part of the curve, as you see here, that's the dance, right? And so we want to be able to loosen those social restrictions. We want society to get back to normal, but we don't want to be that at the price of more cases and more death. And so it's this delicate dance that we play between both of those competing priorities.
Dr. Garza, as someone trying to track the disease, do you feel the state is collecting and releasing enough information on cases? Or are county health departments collecting and releasing enough information on cases? What further data would you like to see?
I believe that they are. The data flow is always challenging. If you think about the way that data has to flow from the healthcare systems and from those other testing facilities, so the ambulatory testing, the way that the lab data comes back is very, it can be a little bit challenging at times because they're coming back from those private labs, they're coming from the state lab, they're coming from hospital labs. And so that's why there's always a little bit of confusion about how many positives are there, how many people are hospitalized, all of those different things. And even reporting on deaths has to go through a certain set of procedures to get from the healthcare system to the state to the county. And sometimes those time lags and those data aren't always syncing up. So I think everybody's doing the best that they can given the challenges of the data reporting systems that we have.
Thank you, Dr. Garza. That concludes the questions that have been received at this time by the public information team for the task force. If reporters have additional questions, you're invited to submit those to the task force public information contacts via email, and we'll do our best to respond to those right away. Questions that we begin to receive tomorrow morning will be collected and read to Dr. Garza during tomorrow afternoon's live stream. Thank you, Dr. Garza, and thank you, everyone, for tuning in for the daily briefing by the St. Louis Metropolitan Pandemic Task Force. Thank you.
Thank you.